Evening. I'm Mary Schmidt Campbell, and as the 10th president of Spelman College, I am so pleased to welcome you to the first town hall of the fall 2021 semester. First, let me congratulate the Spelman College community. Your diligence has kept our positivity rate at 1.5%. That is outstanding. And we've accomplished that rate because everyone in our community has so enthusiastically embraced all of our COVID protocols. 94% of our students are vaccinated. Almost 90% of our faculty and staff are vaccinated. I walk around campus and I see you wearing your masks indoors and outdoors. And I know that everybody has undergone a very diligent testing regimen, and we're so pleased to have everybody participating in the testing. So all together, because of your vigilance, we are able to be together again, to go to class, to eat in the dining hall together, to enjoy gatherings like the ones you had last night, thanks to Pulse, and thanks so much to Pulse for organizing a wonderful event. But we realize that all of these protocols and requirements can become confusing, and particularly when we have to make changes very quickly in those protocols. And many of you have raised questions. So in the coming weeks, we have planned a series of town hall meetings that are designed to answer your questions about our Spelman College and our AUCC COVID protocols. Tonight is the first in our series, and we're going to concentrate on questions that have come from our students. So let me say at the outset, thank you so much to our Spelman College Student Government Association, and particularly to our president, Jillian Jackson, and all of her fantastic administrative team who have helped us solicit questions from students and take each of those questions and very carefully develop the responses to them. Now, to help us answer questions tonight about campus health protocols, we have a panel of special guests. Dr. Darrell Holloman, our Vice President of Student Affairs, will be with us. His office oversees the implementation of all student medical protocols. He's joined tonight by Ms. Kara Garrettson, who has a master's in public health and who is in charge of infection control response and is senior epidemiologist for Morehouse School of Medicine, and what we like to call at the AUCC our COVID czar. Welcome, Kara. We also have with us our interim provost, Dolores Bradley Brennan, who's here also to answer some questions that have been raised that have a particular impact on academics. Welcome, Dr. Bradley Brennan. Good to have all of you with us this evening. Now, we've also heard a lot about the needs of our commuter population, and many of you may know that our commuter population is the largest that we have had in years. And so we also want to append to this town hall an opportunity to answer some questions about the resources that we have exclusively for our commuter students. And Dr. Holloman, who's Vice President for Student Affairs, will be able to answer those questions about off-campus living, including emergency grants, nutrition support, and other resources. Before we begin, let me remind you that this town hall is 45 minutes long. It started at 5 and it will go until 5:45. And throughout, we will be taking questions from our listeners, but the entire town hall is structured around the questions that students specifically have raised and forwarded to our Student Government Association. If you don't get an answer to any topic tonight, please feel free to send your questions to covidinfo@spelman.edu. That's covidinfo@spelman.edu. Also, for your convenience, the town hall is recorded and it'll be posted on spelman.edu later this week. So we're going to start with some of our COVID-19 testing protocols. And we're going to start with Dr. Darrell Holloman. And the question is that has come from a student: is it possible for students to be notified if their COVID-19 rapid test is negative? Dr. Holloman.
Great question, and thank you, Dr. Campbell. Due to the volume and frequency of the rapid testing that occurs during the week, and also that the PCR randomized weekly testing, it is not possible to alert everyone of our negative test results. However, individuals who test positive are immediately made aware of their results so that the college can begin our contact tracing process. The mid-semester PCR test, however, will notify all recipients of test results.
Right. And I've got my test result back already, and it was negative. So how do we know if someone is showing up for testing, and what happens if, in fact, students ignore testing and don't show up?
This is a very important question because we want to make certain that we are all compliant to our testing procedures. It's mandatory that faculty, staff, and students participate in all the scheduled testings regimen as outlined by the AUCC COVID playbook. If a student fails to participate in the scheduled weekly testing, the random, or the 6-week testing cycle, the student will receive a letter of notice from the Associate Vice President for Student Affairs, Darrell Lowe, and a hold is placed on their registration. The student will have until the next testing period to comply. If the student fails to comply by the next testing cycle, they will be placed on interim suspension until they do comply. So this is a very serious matter, and we want to make sure that you are receiving your testing. And if you're not receiving your testing or you have some conflict, please let us know so that we can handle that accordingly.
So what I'm hearing you say is testing is very serious for our students and for our faculty and staff. It's one of the stackable mitigation procedures that we have in place. And we take it very seriously if you don't show up for your testing.
Absolutely.
Thanks, Dr. Holloman. Now, the question also comes up in terms of enforcing wearing a mask. We walk around campus, and of course, if you're eating something, you pull the mask down to eat or to drink. Maybe you forget to put it up, and sometimes, and we all remind each other, mask up, mask up. But the question that has come up is, are the public safety officers responsible for policing that? And what's your response to that, Dr. Holloman?
That's another great question, Dr. Campbell. As you know, we are responsible for wearing our mask both indoors and outdoors, but enforcement of mask mandate is up to all of us. We all have a role to remind each other to mask up. The essence of Spelman Sisterhood is to look out for one another, and we must all look out for our entire community. As a member of our community, our campus police will participate in the practice of reminding us to mask up, just as we all are participating. Although the pandemic is a health concern, and we are definitely concerned for the health and safety of our campus, it is our responsibility for the entire campus to monitor. I'll repeat that. It is our responsibility for the entire campus to monitor. If you see someone who is not wearing your mask, I would encourage you to simply point to your mask and tell them, mask up. This is a technique that I undertake, and it works. Even when I'm in my car, I blow my horn, mouth mask up, and people have complied. If you have a visitor on campus from one of the other AUC colleges, please help us by ensuring that your visitor masks up and follows our protocols. We are all in this together, and it is important that we work collectively as a community to ensure that we keep our campus safe and well. However, if you know that an individual is deliberately defying the mask mandate, you can anonymously report that person to the Dean of Students office by going to the Dean of Students website. I also want to underscore that in the classroom, our faculty have jurisdiction to ask someone to leave their class if they are not complying with the mask mandate. And individuals may be asked to lead programs or activities by college officials if they are not complying with our COVID-19 safety protocols. If individuals become unruly or belligerent, this is a matter that would involve our campus police department. I do want to end this topic on a positive note, because I must say that as the Vice President of Student Affairs, I cannot be prouder of our students. By and large, I'm on campus a lot, and I witnessed that students are complying with our COVID-19 protocols, and we are complying and wearing our masks. You have to be vigilant and dedicated, and it is reflected in our low positivity rates, which, as Dr. Campbell mentioned, is at 1.5%. I also would like to say that from our past PCR 6 weeks cycle, no students tested positive for COVID-19. And so our techniques and our mitigation strategies are working. And so I would just encourage you to continue to be vigilant.
So I have a question. Thank you so much. That was such a comprehensive answer, Dr. Holloman. A question that has come up about testing. And a student wants to know, can students get tested outside of Spelman College?
So that question has come up before. We really encourage you to do your testing on the Spelman campus, because it allows us to make sure that we monitor outbreaks that might happen either in one of the residence halls or maybe in the dining hall, and we can track that information by you testing on campus. We also really don't have the infrastructure in our health clinic to monitor outside testing. So we strongly encourage you to test on campus. I do it every week. I've done the 6-week cycle. It's a very easy process and doesn't take normally more than a few minutes to get through.
And it's free.
And it's free. And Dr. Campbell, I have to say, I had to take the test off campus. It was $185 to take the test.
Oh my. So that's a good thing to remember. It's free. So Ms. Garrison, again, thank you so much for joining us this evening. This question has to do with tracking. And we all know that if someone does test positive, we need to know who has been with them and who might have been exposed having been with them. Is there any way of tracking if any positive test results are coming all from similar places, like all from a residence hall or all from the dining hall?
Absolutely, absolutely. So this speaks to, first of all, I'd love to explain this process. A lot of people have questions about contact tracing. And so what I want to explain is that contact tracing isn't just singularly about the close contacts, who you've been in close contact with, meaning within 6 feet of an individual for 15 minutes or more. What it really boils down to, and the type of information that it gives us, allows us to make decisions on our campuses. For example, your contact tracer will ask you about specific locations. They'll ask you about dorms. They will ask you about your classroom schedule. This type of information helps because it's essentially, it is a guide to where we are seeing these particular positives. And if we need to go to that location to test every single person, to provide additional education, to inform the public, right, that we are perhaps seeing more cases with this particular event or after this particular event, right? So it will allow us to make determinations about our campuses and how and what we need to do to keep them safe. So that's a great question.
Thank you. I'm going to skip to Dr. Bradley Brennan because we're getting a lot of questions that are coming up about Thanksgiving break. So I'm going to go a little bit out of order here so that we can get an answer to this question. Will students be returning to campus and in-person classes after Thanksgiving break? Dr. Bradley Brennan.
Thank you, Dr. Campbell. So yes, students will be returning to campus after Thanksgiving break, the same way that we returned after fall break. The academic calendar has not been altered. So there are still 3 days of classes to enjoy following Thanksgiving. Then we'll have reading period, and the following week we'll have final examinations. And so all that remains in place. It's our expectation that our community will continue to engage in the multiple health and safety practices that we've promoted all semester. As you mentioned earlier, Dr. Campbell, over 90% of our community is fully vaccinated. We've had mandatory face masks. We encourage everyone to hand wash and social distance when possible. And I believe you said we had about a 1% positivity rate, and that's outstanding. And so as we continue the semester, we expect everyone to continue those practices that have kept us so safe. Just as we are doing now following fall break, when we return after Thanksgiving, everyone will have their PCR test so that we can ensure that we are all still in good standing, and to identify any possible positive infection in our community and address that very quickly. This multi-pronged approach has led to a remarkably low positivity rate, and we expect that to continue to the end of this semester, as long as we all continue to do our part to stop the spread.
Thank you. So that was another question that came up. Are we going to get tested after Thanksgiving break? And the answer is yes, you will. And it will be a PCR test, which is the one in which we have the most confidence, right? Dr. Holloman, the question came up about whether there's going to be additional testing after fall break. And I think we all know the answer to that question, since we've all been lining up for our testing. But in addition to that question, here's another one. In the case that someone does become infected with COVID-19 virus, how do you plan to make sure they're quarantined, or as well as to make sure their roommate doesn't catch it? What are our protocols? If someone is identified as positive, what does the college do, and how do you protect other students?
Absolutely. This is a very important question. So if a vaccinated person has been exposed to COVID-19, both the person and their roommate, if vaccinated, will be quarantined and placed in their room and tested after a 48 to 72 hour period. It takes that long for the virus to grow in the nasal passage. Unvaccinated exposed persons are quarantined in our quarantine space in Spelman. I'm proud to say that at the moment, we don't have any students in our quarantine spaces, and we don't have any students on campus who are isolated. If individuals test positive, they are immediately relocated from their rooms to our isolation space in Spelman. Following the student's relocation, their room is cleaned and sanitized by an outside company. Students quarantined are monitored by both the health clinic staff as well as the resident directors to ensure that they are properly sheltering in place. So we make sure that we create enough wraparound services for our students to support them until they're able to resume their normal activities on campus.
Thank you. There's a question about testing, Ms. Garrettson, that has come up in the chat that I want to direct to you. It has to do with, when do we expect to start using the Thermo Fisher testing? And could you explain to our audience the difference between the different testing, the rapid test, the PCR, the Thermo Fisher?
Sure. Absolutely, absolutely. So the first part I'll talk about for a minute is just the rapid testing. So rapid testing is a very quick way for you to essentially know your COVID status. However, with all things rapid, there is a bit of a delay. So with PCR testing, more specifically, they pick up very, very small amounts of the virus. With a rapid test, they may not pick up they may not be as sensitive as a PCR test. which is why, of course, we want to do PCR testing. And if someone should test positive with a rapid test, we also want to confirm with a PCR test. Now, with Thermo Fisher is essentially just another laboratory. And what they did is it's through a program called the JUST Project. And so what the JUST Project did was they looked at medical schools, more specifically HBCU medical schools across the country, and provided them with the resources to build a laboratory so that we can actually stop using outside laboratories, but use our own, right? And so with the JUST Project, they provided Morehouse School of Medicine with the means to build this particular laboratory for this purpose and others, right? And so Morehouse School of Medicine is the hub for multiple institutions across the country that send their results to them. There was a pilot last semester. And so this semester, everything is running smoothly and we can actually take in the influx of testing. And so next semester, spring 2020, fall 2021, where we at? Spring 2022, excuse me, we will start using the Thermo Fisher JUST Project. And you'll actually see where you're able to get your results much quicker because, of course, the laboratory is around the corner. So I hope that answered the question about the Thermo Fisher and the JUST Project.
Right. Right, thank you. And it's also an affirmation of the confidence that, is had in Morehouse School of Medicine. So they will now be our lab. And we should be able to get our results from our PCR tests, actually very, very quickly. So we're very happy to hear that. Dr. Holloman, I have some more questions for you. And one is, what is the protocol when someone is tested positive off campus? So a student does go ahead and get a test off campus and it comes back positive. And so then they come to campus and the test is negative. What are they to think about the discrepancy between the two tests?
Absolutely. And I did, before I answer that, I did notice a question in the chat that I wanted to correct. I was not saying that we have not had positive cases on campus. We've had a low number of positive cases on campus, but as of last week and going into this week, we've not had any students to test positive on campus or in quarantine or isolation on campus. And so that was before the fall break and following the fall break. We use an antigen test for our weekly test, which can result in some positive or negative readings. Any positive test result from the antigen test is immediately followed up by a PCR test to confirm positivity. The PCR test is considered the gold standard of testing. If a student test results from a PCR test reveal that the student is indeed positive and they live off campus, they are directed to isolate off campus and are permitted to return to campus only after they show a proof of a negative PCR test. If you test negative on campus but are experiencing symptoms, you should contact the health clinic services immediately so that we can begin to support you in your health procedures.
Right. So it is possible to take an antigen test and get a positive, and then have a negative PCR test, which is more accurate. That's the message that we're giving. Thank you. Let's just check our questions that are coming in from our Q&A. The question has to do with, is there going to be any opportunity for students to do anything online? Dr. Bradley Brennan, I think this is for you. Are there going to be any courses taught online after the Thanksgiving break?
So, as I said earlier, we expect the majority of classes to be in person when we come back from the Thanksgiving break, and the faculty have had a recent discussion on this and voted on that, as a matter of fact. But we are also expecting that some faculty may elect to have the end of the semester online. And that's a conversation that those faculty who choose to do that have with their students. But as I said, we expect that the majority of faculty will have classes and in final exams in person. Many of them stressed emphatically that that was a necessary component of their courses. And so we're doing everything that we can to make sure that just like after fall break, after Thanksgiving break, we have a safe and productive return.
Thank you. So I want to save some time for us to discuss our resources for our commuter students. This year, we have more commuter students than we have had in the past. We recognize the challenges for our students in the middle of a global pandemic, of a housing crunch here in Atlanta, of trying to make their way back and forth to campus and, also be able to really participate fully in the in-person classes. So I'm going to start with the emergency grant funding, Dr. Holloman, because your office oversees the review of those requests and the dispensation of the funds. Is there a systematic way that students can receive updates as to where they are in the process of receiving the emergency grant funds? We know they submit applications and then they wait and they're not sure when they're going to get the response. So what's your response to that?
So thank you for that question. And I have to personally apologize and take ownership and responsibility for the slowness of the student emergency grant funding process. As Dr. Campbell mentioned, my team manages that process. Following the various announcements, we just were not prepared for the 1,214 applications that came into our office. We have traditionally with our student emergency fund had one person to process that. Since that time, we've added additional staff. And so we have a total of 5 staff who are processing those applications. We also have to verify the information, which also slows down the process because it is federal money. And so our processes have worked diligently. I do want to personally thank each and every one of the women who are working very hard to get through the remainder of this process. I was given numbers today that we have approximately 571 that are remaining, and we are meeting tomorrow to talk about how to disseminate those. And we are very, very hopeful that we will have those processed within the next week or so. I also want to thank our students for their patience. I've been in the office as the students have come into our office to ask questions about the grant, and everybody has been very respectful and very understanding. So thank you for that. And we will get the funds, the remaining funds, out as quickly as we possibly can.
So the majority of the requests have been processed. You have about 500, just over 500 more to process. And your staff is going to work really hard to get those done within the next week or so, right?
Absolutely.
That's really the message. So these are federal funds, and there's a lot of paperwork that is involved with making sure that we've documented every aspect of the selection process and the dispensation process. And speaking of selection process, how do you select who gets how much money?
Thank you. And so everyone qualified for the grant. These are federal funds through the HERF Education Emergency Relief Fund, which is called HERF. And any enrolled student experiencing any financial difficulties related to COVID qualified for the funds. However, we have to track the funds to ensure that what we're dispensing is able to be supported. And so because a student applied for $2,500, which was the max of the fund, did not mean they were automatically granted $2,500. We had to make a decision about how we would fund certain things. And so gas was funded at a certain level, groceries were funded at a certain level. This was to help keep the process equitable, but it was also important because we have to, at the end of the quarter, one of my dear colleagues on this call Helga Greenfield and Don Alston will look at my team and they will ask me how did we disperse this money so they can report that back to the federal government. And I can proudly say that we've been keeping very good records to that regards. Thank you for that question, Dr. Campbell.
Thank you. So we know that one of the ways that the college helped out our students this year was to provide lift passes that were distributed and provided, I believe it was a $400 allocation for the student to receive them. And we're asked if there's going to be a second round of distribution of the lift funds. What's your response to that?
So those lift funds that were distributed were for one time for the entire year. And we recognize that $400 isn't a great deal of money, but we also wanted to make sure that we could give as many people as possible those funds. And so we were able to fund at least half of the incoming commuter student class. So about 550 students received the $400. Now, those funds were meant to be supplemental, and they were not meant for students to, I've heard of instances of students going back and forth to campus in between classes. That's not what the funds were for. The funds were to get people to class, to college, stay, the remainder of the day, and then take the lift back home. Unfortunately, we will not be extending any additional funds in the spring. Those funds, once they're exhausted, they will be exhausted.
I have a question that just came in from our Q&A, and that has to do with students who have to be in quarantine because they have either tested positive or they have been exposed, and they miss classes. Maybe they have to miss multiple classes. Would they be allowed to complete their work online so they don't suffer academically? Dr. Bradley Brennan, I'm going to ask you about what arrangements students can make if they have to miss multiple classes.
Well, this would be handled like any other absence. You would work it out individually with your faculty member. And so you would have to go to each of your instructors to see what accommodations they could make. And in some cases, they might say they cannot accommodate you online. And so then you would have to find out, well, are there other assignments that I could do? Or do I have to take an incomplete?
Or I would imagine that, even pre-COVID, when students get sick, right? Yes, and they have to meet multiple classes. And so faculty have arrangements that they are able to make to help students make up material they may have missed or some way that they have of doing that. And for those faculty who are not offering online options, they would default to those standard ways of making up material.
That's absolutely correct, Dr. Campbell. And in this case, a student should go to the Dean of Undergraduate Studies to help them understand the process for asking for assistance if they're in a situation where they cannot complete the courses.
Thank you. Dr. Holloman, I want to return to the resources that we have for our commuter students. And I know one of the real difficulties has been food insecurity of students who simply don't have enough access to good, healthy food on a regular basis. What are some of the resources that are available either at the AUC, on Spelman's campus, that they can use to make sure that they are eating well and eating well regularly?
Absolutely, thank you. The college is very sensitive to this issue. Overall, the Atlanta University Center has the Mimi's food pantry, where students are able to receive groceries and food that can sustain them through the week if they're commuter students. Mimi's Pantry actually reached out to us, and they are coming to our campus once a week on Mondays between 2 to 4. so that students could have access to Mimi's Pantry. And that grocery store is located in the lower level of Manley.
Can I interrupt you for just a
Yes.
minute, Dr. Holloman? So Mimi's Pantry really is a miniature grocery store, right?
Yes.
Where you can come and do your shopping and get some of your groceries and take them home with you, right? You can do this on a weekly basis, right?
Absolutely. Absolutely.
Okay.
And beyond the weekly basis, when they come to Spelman specifically, they're open 5 days a week in their regular location. You can reach out to the Office of Student Life and Engagement. Letitia Denard coordinates the efforts for our commuter students, and she could be able to provide you with more information. We also have provided information for students about the Supplemental Nutrition Assistance Program, which is called SNAP. When I was young, that was called food stamps. But we also have made connections with that office to help students to step through that process if they're interested in doing that. We have a reduced rate meal plan. So this has been a bit of concern for our commuter students because they felt like the commuter meal plan was too expensive. We had two commuter student meal plans. I think one is about $1,300. The other is a little bit higher. But we met with Airmark, and Airmark actually has a commuter student meal plan where students can add minimally $25 on their student identification card, and they can increase it as needed. And to do this, you would just need to go into the main dining hall and make an inquiry about having to place money on your meal on your identification card. This would allow students to have more flexibility without having to be locked into a particular meal plan. And it's at a very cost-effective rate so that we can be able to provide flexibility so that our students are able to access our cafeteria. The last thing, Dr. Campbell, is that we did raise the prices for our faculty and staff and visitors this year. And we learned that the commuter students were being lumped into that. And so we went and had it, we just had a conversation with Airmark. It wasn't intentional. And so the meal was reduced back to $6 for our commuter students.
Okay. So we really want to make sure that they're able to get that additional plan so they can continue to have those lowered costs. Thank you,
Absolutely.
Dr. Holloman. Appreciate that. Ms. Garrettson, we're getting near our time, and we have several questions about COVID rates. One question is just in general, what are the rates in Atlanta?
Great question. I love answering these types of questions. So we are actually seeing our numbers go down, very similar to what is happening across the country. As vaccine rates increase, COVID-19 decreases. And so right now, and if you compare this to where we are as a campus at 1.5% positivity rate, at the height in August in Fulton County, which is in the city of Atlanta, the positivity rate was 14.3, which is why we had to make those decisions to increase testing, right? Mask outdoors, right? But we're starting to really see a decline. And right now, the positivity rate is 5.8%. And so, yes, it's great news. But again, Fulton County, at least 1% of, for individuals who have received at least one dose, is above 60% now. That wasn't the case here in August, right? As we continue to see our vaccines increase, we'll continue to see COVID-19 decrease. What the World Health Organization would like for all of the country is to get below a 5% positivity rate. Yeah. And so while we are not quite there for the state of Georgia, we are moving in the right direction.
That's very good news. So we have a question also about reporting. A question that says, will the college release COVID-19 reports that include positive results, quarantine, isolation? And I know that you have worked on the AUCC dashboard. So tell us about the information you can find there.
Yes, absolutely. So we have an AUCC-wide dashboard that includes all of our campuses. So on that, on the AUCC, it's aucenter.edu. You can find the AUCC dashboard by just clicking COVID-19. The dashboard will come up, and you're able to see the positivity rate, how many individuals have tested positive since campus has began, what the percent of fully vaccinated, the percentage of individuals who have at least one dose of the vaccine, as well as the isolation and quarantine individuals that we have on our campuses. This information is updated weekly, and it is updated with our data analyst. His name is Taiwo. He works very closely with me. And so he updates the dashboard every week by 5 p.m. on Mondays.
Thank you. Thank you. So we're at almost at time, and apparently a number of questions have come in from some of our latecomers about Thanksgiving. So what we're going to do, Dr. Bradley Brennan, is we're going to send a separate message out to our entire student body that states for everybody what our policy will be about Thanksgiving, about classes, exams, testing, all of that will be in that one message. So we are now at 5:45. Thank you so much to our panelists, Dr. Darrell Holloman, our Vice President of Student Affairs, Ms. Kara Garrettson, our COVID czar, and Dr. Dolores Bradley Brennan, our interim provost. Thank you so much for being with us this evening. Thank you to everyone, to SGA for the wonderful job you've done collecting the questions, and to everybody who attended and filed questions tonight.